For Dr. Miguel Sosa, practicing medicine really is an act of charity. Most of his patients rely on Puerto Rico's Medicaid, and it hasn't paid him, he says, in months, owing him $200,000.
It's a problem because I need to pay to the doctor, to the nurse, to the rent, lights, telephone, water. No?
A staggering number of people here, 2 million, more than half the population, rely on Medicaid or Medicare, and the island simply can't afford it. For years, Puerto Rico's been borrowing to pay the bills, and now it owes providers $200 million.
Is it fair that the doctors aren't getting paid for the work they're doing?
It goes beyond fairness. It goes to the fact that my principles doesn't allow me to owe people money.
And it clearly bothers you personally.
Of course, for me, that's something sacred. If you owe somebody, you pay, period.
Even though Puerto Rico is a part of the U.S., the rules here are different. Decades ago, Congress capped Medicaid for the territories. So Puerto Rico's health leaders say the federal government only pays it about $300 million a year. The island must cover the remaining $2.5 billion cost itself, whereas American states get billions of dollars in help from the federal government.
We are asking is a fair treatment. We pay the same Social Security, we pay the same Medicare tax. So basically, we want to receive the same benefits from what we are paying.
So what does fair treatment look like to you then?
In the case of Medicaid, treat me as Mississippi. And that's all we ask. Treat me as the lowest jurisdiction that you have.
The U.S. is working with the island for solutions, and to help it get by, Puerto Rico got a $6 billion grant to keep the programs operating. But that money is expected to run out a year early, which health leaders fear could force the island to drop close to 1 million people from Medicaid.
The reality is that things in Puerto Rico are going to get worse before they get better.
Hi, how are you?
The pain is already being
Nice
felt.
to see you again.
Patients have seen prices rise, and thousands of doctors leave the island.
Everybody's cutting corners. Hospitals get paid 25% less. You only have 2 nurses per floor instead of a nurse for every 4 patients. You go to a doctor's room and there's 40 people waiting when you get there. Now there's not going to be any more transportation support, and everything's going to get a little more difficult.
As a teacher, Astrid Perez has private insurance, but still has trouble finding doctors. Many, she says, now won't accept credit cards, much less her insurance.
You want to feel better, you want to get better. It's not a luxury, you're not buying something for you.
At 64 years old, Dr. Sosa says he's too invested to leave and too committed to cut off patients.
So are you still then accepting patients who have Medicaid coverage?
Yes.
Even though you're not getting paid for it?
No, it needs a doctor, it needs a medicine, and you can reject this patient because he needs.
Still practicing on an island with a lot of need.
Gracias.